Welcome back. So the Office of the Health Standards Compliance and Health Ombud have validated claims of negligence and despair at the Helen Joseph Hospital. This follows an investigation sparked by a viral video from a patient, Tom London, detailing poor treatment and crumbling infrastructure within the hospital. For more on this, let's now bring in the Health and Wellness Portfolio Committee Chairperson, who will be joining us a bit later on, hopefully, Gauteng, from the Gauteng Legislature, Advocate Ezra Letsoalo. Joining us now, though, is Dr. Angelique Coetzee from the South African Medical Association and former broadcaster and complainant who led to this investigation. Tom London is also joining us for the conversation. Tom, let's start off with you. Very good morning to you. What do you make of the findings of the Health Ombuds?
I'm happy with them. I mean, happy is an interesting word to use when you read these findings. You can't be happy when you read about the state of Helen Joseph Hospital. But what I am happy about is that as a country, as South Africans, we've been talking about these problems for many years. And now we finally have one of our hospitals opened up, dissected, looked at, and we have the problems in black and white. I mean, the conclusions are horrible to read. And I quote, Helen Joseph Hospital as a tertiary hospital is inadequately resourced and thus not fit for purpose. That is the state of Helen Joseph Hospital. I'm glad it's come out. I'm glad we've got the Health Ombud's office. I'm glad we've got the OHSC. I think they've done an excellent job in producing this report. As South Africans, we now have a very clear picture of what's wrong with at least this hospital and possibly many of our others. And we can finally do something about it because there are recommendations and guidelines and timelines attached to this report.
Yeah. And Tom, before I go to Dr. Coetzee, do you think that the unsubstantiated allegations that you've made, including, for instance, that you weren't seen by a doctor for over 48 hours, that dampens in any way the credibility of the allegations that you've made, also, I guess, considering the findings?
Obviously, I'm going to say no. I'm biased. As far as not seeing a doctor for 48 hours, a lot of it's semantics, you know. I maintain that I had a doctor who came to me and said, you're going to see my face for the next few weeks. And his last words to me were, you better get used to seeing my face. And I thought, great, this is the man who's going to take care of me. And then 2 days later, I hadn't seen him. And a ward doctor, a 23-year-old doctor, sorry, I've got parrots, they want to get in on the conversation. A 23-year-old doctor said to me, oh, he's not your doctor anymore. So I felt I hadn't been seen by my doctor for 48 hours. Yes, I was seen by a floor doctor who was seeing the whole floor, but that wasn't the person looking after my case. So, you know, on allegations like that, I'll agree to disagree. On the allegation that I felt we weren't being treated with respect and the dignity we deserve as patients, as South Africans, that was unsubstantiated. It's a bit of a he said, she said situation. And I would encourage the Ombuds office to change the methodology, because they asked one person who'd been in the ward with me and a couple of other people, a handful of people. I think that it would be a good idea to have exit surveys for patients in public hospitals, so that you're running a survey today. That gives you an idea of whether people are happy with the treatment they're getting. But you know, I'll agree with the President in the State of the Nation address, where he said that healthcare workers' attitudes need to improve. Yep. I agree with Ezra Letsoalo, our Premier, in response to the President last week at G20 meetings, who said that there's poor service in our hospitals. And I agree, and I carry the voices of tens of thousands, if not millions of South Africans who've said the same thing as me. We're not happy with the service we get from our healthcare workers in hospitals.
Okay.
So it's okay.
So you're okay with that? Okay. Dr. Coetzee, a very good morning to you as well. Once again, another hospital that has been investigated, and to me, the findings are almost the same to what we saw when the Health Ombuds also looked into allegations that had been made by a doctor at the Rahima Musa Mother and Child Hospital. But then the question is, what happens after all of these recommendations have been made?
Good morning. A very valid question. I don't think a lot happens to all these allegations and investigations, and that needs to be addressed, because if it was addressed indeed, and this was a few years ago, when the first allegation came towards this Helen Joseph Hospital, so if it was addressed, then we would not sit with this problem. But I would like to say that you can take this report, and in most of the public hospitals, you will find similar problems. It's infrastructure problems, it's lack of leadership. We don't get the services for our people that they need. This is not a first off, this is been ongoing. SAMA many years ago already started to complain about the services in these hospitals. And up until today, not a lot happened. Even this hospital, I'm very happy that the Office of Health Standards did an investigation, but we also need to ask them, when they did these clinic investigations and I think it was a year or two ago, can be a bit longer, did they awarded the Helen Joseph Hospital a certificate that they are compliant? I've seen some of these certificates in other clinics that is not compliant. So the Office of Health Standards also need to ask what their role is. We see that when the Office of Health Standards come around to visit these clinics or tertiary institutions, everyone knows they borrow stuff, they make it on the surface, it's beautiful on the surface, but please, underneath, it's rotten. And then everyone is happy, you get your compliance certificate, and then we're back to where we were. The toilets that's not working. I can show you clinics in Pretoria where the water is not, there's no water, the poor ventilation. In the end of the day, it's the patient's health that's compromised, as well as the doctors and nurses working in those institutions. So lack of leadership, lack of anything. We do need to take politics out of medicine. We need to let people.
What do you mean by that? What do you mean by that, Dr. Coetzee, taking politics out of medicine?
We need so medicine is not a political playfield. Medicine, if you want to appoint someone in a CEO position in medicine in a clinic, it should be the person who's got the right merits, not who he's connected with. It should not be a cadre type of deployment. It should be the person that we know that can change this. The whole chain should be changed. We need to look better, and we need to start taking the premiers of provinces. We need to hold them accountable, because in the end of the day, they are responsible for the MECs that they appoint of health and the HODs. It's not the National Department of Health. So it's lying at provincial levels.
Okay, let's just quickly see if we can get Advocate Letsoalo on. Advocate Letsoalo, if you can hear me, we've heard now from a patient, Tom London, we've heard now from Dr. Angelique Coetzee, who is a health practitioner. From a political perspective, what is your response to this and to what Dr. Coetzee is saying, that the Premier too must be held accountable?
Good morning, Dr. Sampi, as well as the viewers at home. Well, I'll tell you, I think there's no denying known and identifiable challenges within the public health system. And much has been said, and much has been recorded in different health review literature, The challenges are known. I mean, already there would have been, an array of assessment reports which depicts what those challenges are. And we know that we've got systemic as well as structural challenges, as it relates to service delivery provisioning, particularly on infrastructure. But I think, speaking in context, I mean, when you go through the report, it makes some observation that what has been, surfaced out of the investigations essentially relates to infrastructure, conditions, which is something that is not coming anew. And I think it has been said before that a great number of our health facilities might be in a dire state. And part of the interventions that should be employed is really turning around the situation as it relates to that. But if you were to look into the actualities of the clinical program, whether that is compromised, and I think the report also makes a point that insulated from extraneous issues that relates to infrastructure, you might find that clinical programs are actually delivered to standard, and there are reports to that effect. Of course, that is not to delegitimate some of the known assertions made about those contending challenges. But where I think we need to be sensible and cautious is not to make a sweeping statements that might present the health system as non-existent or even collapsed entirely, because it's still functional. Yes, there are major challenges, and I think those challenges, every sector of a society does admit to those. In respect of the premier having to be held accountable, look, you have got hierarchies and an ecosystem within the public health system. There are managers at different health facilities which are responsible, so they are not just the saving in a hollowed way, but they are there to carry out obligations. And of course, you have got political overseers. I mean, that would be in the form of the provincial department led by an executive authority, who would be the MEC. And of course, even the MEC accounts to the premier. So if you're asking whether there should be accountability right there at the top, I think it's integrated. That is the design of the system. You will have seen it even on previous occasions. The premier is still accountable to the users of these systems. So it's not as if the premier is in any way, insulated from any liabilities, from any accountability. Still accountable.
Do you, as the health committee, have any recollection of when you had asked the premier to appear before the committee because of the state in which our hospitals and health facilities are in the province?
Well, I can recollect my predecessors because they were coming in a bit anew in respect of our oversight function. But of course, the MEC does appear. And remember, the MEC is delegated responsibilities born out of EXCO. So for all intents and purposes, you can deem that the MEC has even been designated by, EXCO, by the premier, directly accounts, at that level. And of course, there has been instances, in fact, quite a number of occasions where the MEC has appeared before the committee to come and answer in respect of a number of challenges, not specifically infrastructure challenges alone, but a number of challenges that plagues the health system.
Okay, we're going to take a quick ad break. When we come back, we're going to continue the conversation. And I guess what I want to know, maybe from Tom London as well as Dr. Coetzee, is considering what Advocate Letsoalo has now detailed around the health MECs appearing before the committee, is what does oversight then look like? Is it enough to just appear to answer questions, but if those questions and answers do not lead to changes within the health system, is that adequate? That conversation after the short break. Stay tuned to Channel 405. This is the AM Report. Welcome back. We're still in conversation with the Health Wellness Portfolio Committee Chairperson in the Gauteng Legislature, Advocate Ezra Letsoalo, as well as Dr. Angelique Coetzee from SAMA and former broadcaster and complainant in the Helen Joseph matter, Tom London. Tom, you heard what Advocate Letsoalo had to say, what Dr. Coetzee had to say. I want to know what your take is. And here's the thing about it, is that the complaints that you have highlighted, Tom, were not new. But I guess with the public profile that you had, you were able to take it and cast the spotlight on some of these issues. But in terms of consequence management and fostering a way to change the experiences of patients at hospitals, are you satisfied with what you've just heard from Advocate Letsoalo?
Look, I'm all for oversight and oversight committees. And if you take a look at South Africa's systems that we have in place, governing our healthcare system and other departments and sectors, we've got very good oversight functions and delegations. However, I think the best oversight is the public, is us, South Africans. I think the people who are best qualified to talk about whether the service is adequate or not are the patients. The people who are currently lying in beds of our public hospitals and institutions. My impression, from what I get told on a daily basis from average South Africans in our system, is that the system is limping along. Yes, clinically, we're able to get someone from A to Z. And I must mention, I think there's a problem that we're not mentioning when it comes to good clinical care in our public hospitals. Things take a long time. CAT scans can take 5 weeks, X-rays can take days. That's not good for clinical outcomes. So while we're praising ourselves for the clinical outcomes in our hospitals, let's just remind each other that we are notorious for taking a long, long time to get to a diagnosis and to get all the tests done. Many South Africans will bear me out on that. As far as these reports having an impact is concerned, they should have an impact. They should have had an impact when we first started reading these reports. And I'd like to point a finger at us South Africans here, the general public now. We've been a bit apathetic, I think. We haven't read these reports. We haven't taken part in the public participation forums. You know, we kind of, it's very easy as South Africans to stick our heads in the sand and ignore what we see happening. But when it happens to us, all of a sudden it's a big drama. The thing that I like about this report is that you, the media, us South Africans, we're watching it. There's a big spotlight on this now.
Yeah. Yeah. And Dr. Coetzee, one of the other points raised, and you can respond to what Advocate Letsoalo had to say as well, in this report is the point around staff shortages. Here's a hospital that has gotten a certificate to be, well, that has been designated a tertiary hospital. However, though, it doesn't have the necessary resources to get there, including the staff members. A 30% staff shortage. That's shocking. Dr. Coetzee, just quickly unmute.
Could I jump in there on the staff shortages for a second?
Okay, I'm going to give you a minute, and then I'm going to go to Dr. Coetzee. You can go ahead, Tom.
It's going to take me 30 seconds.
Okay.
There are 392 vacant nursing posts at Helen Joseph Hospital. I repeat that number, 392 vacant nursing posts. Can you imagine the strain that the existing and current nursing complements are under in that hospital? 392 vacant nursing posts in one hospital.
All right. Dr. Coetzee, your response to that? Hi, Dr. Coetzee, can you hear us? Okay, unmute, please. Okay, we seem to have a problem there with the line to Dr. Coetzee. We'll try to get back to her. In the meantime, Advocate Letsoalo, how do you respond to this around the shortages in these hospitals? Tom points to the fact around the strain that is experienced by those that are actually employed at that hospital.
It's actually something that we have also observed across the board. In fact, in the last 3 weeks, we're undertaking a number of oversight visits, not only at the level of hospitals, including at the level of the clinics, and we unravel some of these shortcomings. But of course, upon a further probing, what we came to the realization was that in a number of instances, and without necessarily, approving of the numbers have been bandied around, is that in many instances, at the level of the facilities themselves, as in when there are vacancies, they might not be immediately declared, such that you allow for formal processes to ensue, which facilitates the recruitment or at least the filling of those specific vacancies. But of course, as it stands, and with the reality of the limited fiscal space, we had been told by the department that there's an instruction, a note, that there shouldn't be any recruitment of additional personnel outside of the approved organogram. Of course, a number of facilities are moving full swing in fast-tracking the filling of specific vacancies that are there. And what we have also observed in respect of hospitals, central, regional, tertiary hospitals, is that with the expansion of the catchment populations, and you can imagine Helen Joseph covers a catchment population exceeding a million, and also with referral, pathways that adds on to the already existing burden of the facility. You then have got a thoroughgoing need to expand even the organogram. But unfortunately, these organograms are centrally approved. I know there's currently a process which has been heralded by both the provincial as well as the national department to review existing organograms so that you can be able to fashion the kind of organizational structure that responds to the day-to-day realities, particularly with the number of patients that present themselves to all of our health facilities. So it is a reality that there is a shortfall of personnel, clinical personnel, as well as a non-clinical personnel.
All right. What is the committee going to do now with this report and its findings? Will we see any heads rolling at all? Or is it just enough to say that, hey, listen, unfortunately, there's not much that could be done by the workers on the ground as well as the management of the hospital because we don't have money?
Of course, this report surfaces a number of issues that have also been previously recorded and observed by the committee. So there are a number of reports presented, as I said earlier on, by my predecessors, and these reports are being actioned. Of course, the turnaround time might be a bit slow, and I know there's been a number of interventions in a number of areas, particularly with, the purchase of machinery, equipment, the process to really resolve the standing on a shortfall of, clinical personnel. It's one of those things that have been, a follow through by the committee. Of course, the committee will have to study the report, which we really haven't had time to do, and then look into how to ensure the actualization of those specific recommendations. I don't think there's any way of arguing with those stated recommendations. They are made by a legislative body, and they should be actioned. So the committee will oversee that as part of its oversight, as part of its scrutiny of the programs of the department.
All right. Dr. Coetzee, let's try your line again. Your closing remarks and also to what Advocate Letsoalo had said earlier on in terms of accountability.
Thank you so much. I just want to say I haven't heard that Mr. Letsoalo said that the Premier has been asked to come to the committees and to respond. So it's all well and good to have the MEC there and the MEC saying, I will do this and this and this, and then everyone is happy, and then there's a report, but no one go out to the ground level. The problem is lying at ground level. So you can sit in your offices and you can try your utmost best to do a good job. But if there's no feet on the ground with unexpected visits, then you will see the problem.
So we undertake these visits via oversight. We visit these hospitals, so we're not oblivious to the day-to-day realities of patients. We even convene stakeholder engagements. So I think it would be a bit disingenuous to assert that the committee is far removed from, the actualities on the ground.
Mr. Letsoalo, I'm sitting on the Skinner Street Clinic. Advocate Letsoalo, I'm sorry. I'm sitting on the Skinner Street Clinic committee, and I can promise you, if you see what is happening in that clinic, it is not acceptable from a medical point of view. You can say that the clinical skills are good and great, but if your ENT set is not working, if there is no proper power, if there is no internet connection and the doctors need to use their cell phones to get reports, then I'm saying, I'm not disingenuous. I know what I'm talking. Unfortunately, I also am at ground level because I've realized if you do not put your foot into it and starting to see what is happening, then you cannot make allegations. So I know what I'm talking about. And I'm not going to say the MEC is not doing her work. None of that. All I'm saying is we've got serious problems. You cannot fix a hospital like Helen Joseph anymore. When it was not built for modern medicine. You need to relook at that. You need to build a proper hospital or a proper clinic, look at what is the needs regarding the HR requirements. 2018, the 2030 Human Resources document has been released. Up until today, nothing happened on that document. We know what should happen at a clinic level. You need to look at your patients that serving or coming to that clinic or tertiary hospital on a monthly basis. Then you need to plan your HR around that. It's not happening.
Okay. Unfortunately, we've run out of time. Thank you so much to my panel this morning. Tom London, former broadcaster and complainant, who led to this investigation into the Helen Joseph, to the situation at the Helen Joseph Hospital. Dr. Angelique Coetzee from the South African Medical Association, as well as Advocate Ezra Letsoalo, who is from the GP Legislature on the Health Committee. Thank you so much for making time for us this morning.